I have 4 kids, 1 boy, 3 girls.
I have 4 kids, 3 girls and 1 boy.
I have 5 kids, 4 boys and 1 girl.
I have 3 kids, 2 boys and a girl.
I have 1 daughter, twin boys on the way.
I was a teen mom.
I'm a single parent.
Head of household.
And I want to make a change.
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 I would like to make a change.
The mission of Harmony Garden is to build community research partnerships to grow healthy girls, and this program reflects our partnership with the Cincinnati Metropolitan Housing Authority.
These women all grew up in the West End. They all were teen mothers and faced the challenges of being a teen mom. We were really interested in having them become community resident researchers to impact and change in their community and make a difference so that their daughters and all of the other girls who are growing up in the West End of Cincinnati do not face the same challenges. We chose to focus on the West End because the PULSE study, the study of the status of women and girls, found that there were tremendous health disparities among girls and women living in the city of Cincinnati.
It was a challenge growing up in the West End, but it was an experience that I wouldn't trade in for anything.
Just looking at the total entire environment of the West End and the health issues are very important.
The purpose of the Community Resident Research Team is to collect information that will lead to action in the community.
This is a pilot project, and the Harmony Garden hopes to move within the greater Cincinnati region from community to community and find out what are the health concerns specific to that community.
Our mission is to give and collect information to promote the health of girls in our community.
I think it's important to have community resident researchers in different communities because we came out the community.
They know best of what the community needs, the best way to approach a problem or an issue, and the best way to find a solution to that problem.
It gives us the opportunity to express what we feel, and it gives them the opportunity to provide the programs that the people that is impacted need. Organizations bring programs into our community that they think we need when they really don't know the need of the community.
As a community researcher, I want to help by giving our community a voice.
I feel as if I can help raise awareness in my community.
They most recently conducted a health assessment where they surveyed residents that reside in the West End community and asked them what their 3 priority health concerns are for girls.
They were concerned about the violence in their community, they were concerned about drugs, and they were concerned about sexually transmitted diseases and pregnancy. They collected 120 surveys in about 2.5 hours, which is phenomenal. I mean, it's very, and it shows the relationship that they have with the community members.
We're starting to see a lot of teens in this area become pregnant between the ages of 13, 17.
At this point, there are still questions we want to have answers to regarding those top concerns. So now the team is getting ready to design some focus groups. Harmony Garden's ultimate goal when we talk about programs for healthy girls is to have programs that are evidence-based, so there is data to show that whatever the focus is of each program is actually making impact. Girls in the community grow into the women of the community, and the women of the community primarily raise the children, who are then going to be the women and the men of the community.
I want to teach my daughter, as me being a teen parent, I don't want her to be a teen parent. I want her to finish school and have family values.
With this research team, we've started to break that cycle because now they have a different perspective of how they want to raise their children.
I want my daughter to go to school, to learn, and to graduate from high school and proceed college, and I want her to be healthy.
When my daughter grew up, I want her to have a better point of view of our community than what I have. I want her to stay in school. I don't want her to drop out. I don't want her to be no teen mother.
We have seen tremendous change in the women who are part of this community resident research team. So you can see that they are, in a sense, healthier emotionally and physically.
What it has done is made them feel much better about themselves, which is my #1 thing. and then plus show them something that nobody else has been able to show them, that they can get a job. They don't have to sit on the corner. You can go to work.
I've seen a tremendous change in them. Now they're working, they're making sure that their kids, they're putting education first.
As a member of Harmony Garden, it helped me build confidence in myself. I learned a lot of positive things.
What I like the most working in the Harmony Gardens is that we learn and experience that we never had, like using a computer.
It's putting food on the table. It's teaching me how to get back up and be work on time, care about what I put on for the day.
They're looking, I think, at themselves and looking at their daughters and their community as a whole in a different way with regards to health.
If we can engage small pockets in our community around a larger issue such as girls' health, it will get everybody on the same page, sharing the same vision for girls, and therefore sharing the same vision for women.
They are definitely making their impact within the community.
Us in the community, we can make a difference.